Hi, this is Ryan Kelly, Managing Editor for the Journal of Emergency Medical Services, and I'm here with Dr. Sanjaya Karki from Nepal, and he is one of the EMS10 Innovators in EMS Award winners for 2016. Welcome, Dr. Karki.
Thank you very much.
It's very nice to meet you.
Nice meeting you.
So you won this award on recognition of starting a helicopter EMS and ground EMS service in Nepal. Can you tell me a little about that?
Yes. Actually, if I have to say very clearly, that there was, these patients were being carried from remote place of Nepal to Kathmandu, even from the mountain to Kathmandu, earlier also. I mean, before starting HEMS, Helicopter Emergency Medical Service from Grande International Hospital, where I work now. Mm-hmm. So before that also, it was being conducted. But the things that we have changed is sustainable, scientifically approached, and methodical. Mm-hmm. For example, earlier pilots were going there, I mean on the scene or in the crevasse or wherever needed, and patients were being carried without any medical support or any medical equipment, medical device, medics inside the helicopter. There were no. Mm-hmm. So October 29th, 2013, when our helipad started to operate, then we decided that, okay, if helicopter is called, at that time, if we can put our emergency specialist or experts in this kind of field, and then nurse or paramedics inside, then treat patient unseen, and then while bringing the patient back to Kathmandu, on the way also treating the patient would be great outcome. That is how actually we started the program.
So you were moving the treatment of the patient to the scene instead of simply going to the scene with somebody who was basically fetching the patient and bringing them to you. You actually put the nurses and paramedics on the helicopter to bring them to the scene.
Exactly, right. That's correct. For example, if somebody is stranded in the crevasse or if there is trauma in the mountain, then if the helicopter goes alone, who knows that a helicopter might bring the patient dead. So instead of that, we built a system that, okay, it's a helicopter emergency medical service definition, and the system we are following that, okay, we send paramedics, doctors with all the equipments, ventilator, AED, all those vacuum mattress, all those inotropes, all the life-saving drugs we send, and after that we treat patient unseen. While bringing patient back to Kathmandu also, we treat on the way, and then we manage the patient accordingly.
That's amazing.
Yes.
It sounds like there were probably a lot of roadblocks and challenges that you must have had to overcome to implement this. Can you tell me about some of those?
Yes. Actually, this as we faced a lot of difficulties. Actually, we faced a lot of challenges to come up in this way. Actually, this in Nepal, first thing is our geography is very difficult, although very beautiful, but it's difficult. For example, we have terrains, we have mountains, we have hill stations, we have plain land and everything. But what happens is we do not have road assessment up to the periphery. Mm-hmm. There are so many difficulties, there are so many challenges are there. People have to walk 2-3 days to go up to the destination or to the mountains or in the different localities. So we brought this system is giving a lot of help, support to the people who are in the remote place, plus who are going for the traveling, trekkings, mountaineering also. But we faced the challenges because it's first of all, it was very difficult for us to convince the people that, okay, look, actually this is also a system, this is existing system in the world. Mm-hmm. But we are going to start this system. If you need any help, or if somebody is seriously ill, just let us know to save the life. Let us know. We are ready. We are all the time, 24/7. We are ready. We are standby. Mm-hmm. In Grande International Hospital. We have a separate department, pre-hospital care, associated with emergency department. 24/7 team are ready. So if someone is in dire emergency or someone is in need of help, so let us know. So this is how actually we try to convince the people, but it was difficult. But now actually some people, they know about our system and our this service. So we are getting called these days more and more.
That's great. And where does the funding come from for the service?
No, actually we didn't have any funding. The funding is like, we have a department, pre-hospital care department associated with emergency department in the hospital, entirely being done by hospital.
Wow.
There is no actually any external funds. Like what we do is, there's no insurance system in Nepal. So if somebody wants to come to our hospital or in the another hospital via helicopter, then if they are ready to pay, or like if they have some kind of insurance policies is being covered to them, so for them it's easy. They will arrange the helicopter, or in need we are ready to arrange the helicopter for them. But our team will be there inside the helicopter. As far we do not have our own helicopter, so we also rely on the commercial helicopters in Nepal. So actually we do not have any external fund. It's entirely by the Grand International Hospital.
Wow. Well, that's an amazing story, and thank you so much for traveling so far to receive this award.
Thank you very much. And it's my great opportunity to express my this system about my system through this Journal of Emergency Medical Service, and I'm very happy.
Thank you, Dr. Karki. That's an amazing story.
Thank you.
It's a pleasure to meet you.
Yes.
This has been Ryan Kelly for the Journal of Emergency Medical Services, and I'm here with Dr. Sanjaya Karki from Nepal, who was one of the EMS10 award winners for 2016.